Hello everyone, welcome to my channel. Today I'm going to talk about adrenergics or sympathetics. This is a very important topic in pharmacology, and before I start the topic I want to give a little bit introduction about what we are going to study in today's topic. So adrenergics are nothing but the medications that can stimulate certain nerves in our body. So before I begin, I would like to explain about the nervous system a little bit. So we already know that nervous system is classified as central nervous system and peripheral nervous system. Central nervous system consists of brain and spinal cord, whereas peripheral nervous system has motor neurons and sensory neurons. Alright, and this motor neurons is further classified into somatic nervous system and autonomic nervous system. This autonomic nervous system is further classified into sympathetic division and parasympathetic division. So today we are going to study about the drugs affecting these systems. Okay, so I hope you are clear. Nervous system is classified into central nervous system and peripheral nervous system, and central nervous system consists of brain and spinal cord, whereas peripheral nervous system has motor neurons and sensory neurons. And motor neurons are of two types. They consist somatic nervous system and autonomic nervous system, and autonomic nervous system is further divided as sympathetic division and parasympathetic division. So in brief, to explain about what does sympathetic division do and how does our body function in the parasympathetic division is, the fight and like, let me give you an example before I talk about this fight or flight response. So in case you see a snake, okay, and if it's a small snake and you think it's non-poisonous, maybe you will fight it. But if it's a dangerous snake, or in general, if you're scared of snakes, you would run, right? So this response is caused due to stress in our body, and that happens because of sympathetic division. Okay, whereas parasympathetic division is rest or digest in our body. Okay, so let us talk about in detail. So now we are talking about adrenergics. Okay, like I told you, adrenergics are medications that stimulate certain nerves in our body. Okay, now coming to the sympathetic nervous system. I'm sorry about the sound at the background. There is some construction going on, so I apologize about that. So what happens during rest? During rest, there is little bit of sympathetic tone, but parasympathetic tone dominates. Okay, if you're asked in your exams, or like it's even a generally asked question, whether at rest does sympathetic nervous system play a role, because we said that sympathetic nervous system plays a role when there is stress in the body, but there is a little bit of sympathetic tone even during rest, but parasympathetic tone dominates. All right, now, so what happens during stress to our body? Our body adjusts its function in response to stress. Okay, there will be, you can feel that your hands are cold, You can see some sweat. You will have hypoglycemia. So these are all other symptoms. Okay. And during emergencies, whenever there is emergencies, SNS is activated, sympathetic nervous system is activated, and it gives fight or flight response. Okay. Now, what happens in case of stress? We can see that our body releases epinephrine. Now, what is this epinephrine exactly? So, if you do not understand any term, try to split it. Okay, nephrin means nephro, right? Related to kidneys. And epi means above. So, epinephrine, it is a hormone that is released from adrenal medulla that lies above the kidney. Okay, so this is the adrenal gland, and from here epinephrine is released. Okay, so what happens during stress? We learn that epinephrine is being released in the body. Okay, and heart rate increases, cardiac output increases, and then blood pressure also increases. Okay, so what happens during a fear reaction or a stress is whenever sympathetic nervous system is activated, you can see that there is arteriolar vasoconstriction. That is the reason that you can see increase in BP, blood pressure, or hypertension. So remember, during the sympathetic activation, so this all is happening when there is sympathetic activation. You can see heart rate is increased and it is called as tachycardia. Okay, and blood pressure is increased, and you can see dilation of pupils, and that is called as mydriasis. Okay, and salivary gland secretion is decreased. Okay, so for example, imagine when you cry, what happens is your saliva will be more thick. You can see that there is a thick and ropey saliva. That's because your secretions are decreased, so there is thick saliva over there. So let us review till here what we have studied. So we have studied that nervous system. I'll change the color so that it will be easy whenever we review the class. So nervous system is divided into central nervous system and peripheral nervous system. Central nervous system has brain and spinal cord. Peripheral nervous system has motor neurons and sensory neurons. And motor neurons are further divided into somatic nervous system and autonomic nervous system. And we are actually going to first study about autonomic nervous system, how it works, and we are going to study the pharmacological aspects of it. And autonomic nervous system is further divided into sympathetic division and parasympathetic division. And during rest, there is parasympathetic tone, and during fight or flight response, you can see sympathetic tone. Okay, now coming to sympathetic nervous system. So whenever there is stress, we know that sympathetic nervous system plays a role. And during rest, parasympathetic tone dominates, but it doesn't mean that there is no sympathetic tone. There is very little sympathetic tone present. Okay, during stress, you can see that you feel cold, you have sweat, and there's hypoglycemia. During emergencies, what happens is sympathetic nervous system is activated and we will have a fight or flight response. Like the example I gave, whenever you see a snake, definitely you will run, right? Mostly. Or else if it's some small animal, you'll try to fight. So that happens because of sympathetic tone. So during the stress, there is a hormone that is released from the adrenal gland that is situated on top of the kidney, and that is called as epinephrine. Okay, so what all can you see whenever sympathetic activation is seen is you can see that heart rate is increased, that is tachycardia, cardiac output is increased, there is hypertension, and you can see that pupils are dilated. It is called as mydriasis. Okay, so you can see dilation of pupil, and you can see that saliva secretions are thick and ropey because secretions are usually decreased in case of stress. Okay, now let us study about parasympathetic nervous system functions. Okay, so this is required for life to maintain essential digestion and excretion body functions. Okay, then they are completely opposite to sympathetic nervous system. So just for review sake, we have seen that heart rate increase, there is cardiac output, blood pressure is more in sympathetic nervous system. You see dilation of pupils, and you see that there is decrease in secretions of salivary glands, right? So here, everything happens opposite. This you can see heart rate is decreased, cardiac output is decreased, blood pressure is decreased, and there is constriction of pupil. Okay, and that is called as meiosis. Okay, and salivation increases. Now, let me tell you about something. Due to the anatomic wirings in the body, what happens in sympathetic nervous system is it operates as a complete system, means all the organs work together. Okay, whereas in parasympathetic nervous system, what happens is they function as discrete units. All the organs don't work at once, and if all the organs do not if they work as a complete unit, then that's not good, and that can lead to organophosphate poisoning. Okay, now what are the cranial nerves with parasympathetic activity? They are third nerve, seventh, ninth, and 10th. Okay, oculomotor, facial nerve, glossopharyngeal nerve, and vagus nerve. So we are going to talk about types of drug receptor binding in the next class. But before that, let me tell you something. How to remember the 12 cranial nerves. So there is a mnemonic. You can remember that on old Olympus towering tops a Finn versus German viewed some hops. Okay, and on the side, also remember this and write this down in the similar way. Some say marry money, but my brother says bad business makes money. Okay, so and then you can write the nerves here. This is olfactory nerve, then you have optic nerve, then you have oculomotor nerve, then you have trochlear nerve, then you have trigeminal nerve, then you have abducens nerve, then you have facial nerve, then you have vagus nerve, then you have glossopharyngeal nerve. Sorry, this is not vagus, this is vestibulocochlear nerve. Vestibulocochlear nerve. Then here V stands for vagus nerve. And then you have accessory nerve. And we have S, so it's actually spinal accessory nerves. And H stands for hypoglossal nerve. Okay, so these are the 12 cranial nerves. And what does this mean? Means S means sensory, motor, and B means both. So olfactory nerve has sensory function, whereas like trigeminal have both sensory and motor function. So here S stands for sensory, and M stands for motor, and B stands for both. Okay. So I hope you have understood till here, and if you have any questions, you can leave your questions in the comments below and I will answer them for you. And if you want me to make any specific video, you can leave it in the comments below, the topic of your interest. Okay, so thanks for watching and stay tuned to my channel.